Hello and welcome to part 2 of lower extremity anatomy. We're going to begin part 2 by discussing specific details, including articulations of each of the 7 tarsal bones. Let's begin with calcaneus. So the calcaneus, or the os calcis, as it's also known, is the largest and strongest bone of the foot. The posterior portion, seen here, is often called the heel bone. That's what you can feel on the back of your foot. The most posterior inferior part of the calcaneus contains a process that we call the tuberosity. The tuberosity can be a common spot for bone spurs, and those are sharp little hooks or outgrowths of bone that literally just grow out of that tuberosity. And of course, that can be very painful when you're walking or bearing weight. Now, the tuberosity is important because certain tendons attach to that tuberosity, including the Achilles tendon. And notice at the widest part of the tuberosity, there are 2 small rounded processes. The largest is the lateral process, and the medial process is the smaller and less pronounced process. Another ridge of bone on the calcaneus that varies in size and shape between patient to patient is the perineal trochlea. You can see that here. On the medial and proximal aspect of the calcaneus is a larger, more prominent bony process called the sustentaculum tali. And sustentaculum tali literally means support for the talus. Okay, remember the talus is another tarsal bone that sits right on top of this front part of the calcaneus. So the sustentaculum tali is providing support for the talus. Remember, the talus articulates with the tibia. So all of the weight of our body is being transferred through the tibia to the talus to the calcaneus. And so these large processes are important for support. I'm going to warn you right now, I need you to know how to spell sustentaculum tali. Okay? All right, let's discuss the articulations of the calcaneus next. So the calcaneus articulates with 2 bones. Anteriorly, if we were to look at a foot here, you'd see that the calcaneus articulates with the cuboid. Superiorly, the calcaneus articulates with the talus, which we just talked about. So imagine the talus sitting on top here. We've removed it, and we're going to talk about these articulating surfaces here in just a second. Where the calcaneus articulates with the talus actually forms a joint, and we call that the talocalcaneal joint or the subtalar joint. So subtalar meaning below the talus, and of course talocalcaneal refers to the names of the bones that make up the joint. So notice where the talus articulates with the calcaneus, there are 3 surfaces. And I want you to know these names. Notice there's a typo here. This, we're going to call this a surface. Okay, I think they might call it a process because there's a little ridge here, but I need you to just know these as surfaces. So the posterior articular surface is the largest. Then we have the anterior and the middle. Not medial, it's middle. Okay, just be careful about that. Now, on the surfaces, do you notice how these little areas are kind of colored in purple? Well, on some of our bones, where they articulate with other bones, we have these things called facets. F-A-C-E-T. And a facet is basically just a surface that articulates or joins with another surface on another bone. So you could call this the anterior articular facet or the anterior articular surface. I would be fine with either one. The middle articular surface or facet, notice it's right on top of the sustentaculum tali. And again, that's really providing a lot of support medially for that important joint that's bearing so much of our weight. Okay, notice there is a depression here, kind of in between the posterior and the middle articular surfaces. That's called the calcaneal sulcus. Remember, sulcus refers to depression or groove. Now, this depression combines with a groove on the talus, and it actually forms an opening for ligaments to pass through. So again, imagine the talus is sitting on top of this bone here. So there's a groove on the talus combined with this groove that forms a hole in which ligaments can pass. And this hole is called the sinus tarsi. And you really see the sinus tarsi nicely on an oblique foot. And think about the name sinus tarsi. Sinus refers to hole or cavity, and tarsi referring to the tarsals. Okay, so we'll talk more about the sinus tarsi in lab. Okay, so here we can see the articulation between the talus and the calcaneus much easier. I know it's difficult to kind of talk about these structures without being able to see them. So let's talk about the talus next. So the talus is the second largest tarsal bone, and it's located between the tibia and the calcaneus. So this is a lateral projection of the foot here. So the tibia would sit right here on top of the talus, and then the talus sits on top of the calcaneus. So remember, the weight of the body is transmitted through the talus into the calcaneus. So these bones are really thick and strong to help bear the weight of the body. Remember, we talked about the articular surfaces and their facets. Okay, so the posterior, the middle, and the anterior. And I want you to know that the talus articulates with 4 different bones. So remember, superiorly, it actually articulates with both the tibia and the fibula. Inferiorly, it articulates with the calcaneus. And then anteriorly, you can see the talus articulates with the navicular. Okay, so here's calcaneus, here's talus, cuboid, navicular. Okay, so talus articulates with 4 bones. All right, next let's talk about navicular, cuneiforms, and cuboid. So the navicular is a flattened, oval-shaped bone located on the medial side of the foot. So here's medial, here's lateral. The navicular articulates with 5 different bones. So posteriorly, the talus, laterally, the cuboid, and anteriorly, it articulates with all 3 cuneiforms. All right, next, the cuneiforms. So the 3 cuneiforms, and cuneiform means wedge-shaped, that's where it got its name. The cuneiforms are located on the medial and mid aspects of the foot between the first 3 metatarsals distally and the navicular proximally. Okay, so in other words, the cuneiforms are in between the metatarsals and the navicular. The largest cuneiform, which articulates with the first metatarsal, is the medial cuneiform. The intermediate, or the second cuneiform, which articulates with the second metatarsal, is the smallest of the 3 cuneiforms, and the lateral, or third cuneiform, articulates with the third metatarsal distally and with the cuboid laterally. All 3 cuneiforms articulate with the navicular proximally. Okay, so let's recap their articulations real quickly. The medial cuneiform articulates with 4 different bones: the navicular, the first and second metatarsals, and the intermediate cuneiform. The intermediate cuneiform articulates with 4 bones as well: the navicular, the second metatarsal, and the medial and lateral cuneiforms on each side. The lateral cuneiform articulates with 6 different bones: the navicular, the second, third, and fourth metatarsals distally, the intermediate cuneiform, and the cuboid. Okay. All right, lastly, let's talk about the cuboid. So the cuboid is located on the lateral aspect of the foot, distal to the calcaneus, and proximal to the 4th and 5th metatarsals. The cuboid articulates with 5 different bones: the calcaneus, the lateral cuneiform, the navicular, and the 4th and 5th metatarsals. Okay, we are going to conclude part 2 here. We will pick up part 3 discussing the arches of the foot.